Hi, I'm Lynn from Stratpharma. Welcome to our product training videos. These videos are designed to teach you about the indications for our products and how and when to recommend our products for your customers. Today, we are going to learn about stretch marks and how Stratamark can both prevent and treat stretch marks. Many people don't realise that stretch marks are a type of scar. They are a well-recognised and common skin condition that affects between 60 and 70% of pregnant women. And when you look at stretch marks under a microscope, you can see that they look just like an atrophic scar. The collagen ruptures and the gap is filled with newly formed collagen to form a stretch mark. There has been no relationship found between the amount of weight gained or the size of the tummy during pregnancy and whether or not you will develop stretch marks. In fact, it is hormonal changes that are one of the main risk factors for the development of stretch marks. There's also no significant difference in the development of stretch marks in women who have used topical products with active ingredients such as oils and moisturizers and women who received a placebo or no treatment at all. Those products such as tretinoin or lasers that can be used to treat stretch marks can't be used during pregnancy, so they only treat stretch marks, they don't prevent them. Here you can see the skin under a microscope. On the left is normal skin and the center diagram and the right are stretch marks, where you can see the disruption of the collagen in the dermis that looks like an atrophic scar. Stratamark is a registered medical product developed to both prevent and treat stretch marks. Stratamark is a gel that dries to form a thin, transparent protective sheet over the skin to prevent and treat stretch marks. This flexible film is not absorbed into the skin and softens and flattens raised and depressed stretch marks. It relieves itching and discomfort of stretch marks and reduces redness and discoloration. Because Stratamark is not absorbed and does not contain any alcohol, parabens or fragrances, it is suitable for pregnant women, breastfeeding mothers, children and people with sensitive skin. So how does Stratamark work? The thin film formed by Stratamark is semi-occlusive and gas permeable. This allows the skin to breathe and remain hydrated. Stratamark is also hydrophobic, which means it helps to prevent water loss from the lower dermal layers of the skin. The film protects the skin and helps to normalize the production of collagen to prevent stretch marks from occurring. It does this by influencing the fibroblasts, which signal collagen production. In a study done in Europe with 303 pregnant women, Stratamark was evaluated to see if it could both prevent and treat stretch marks. There were 148 pregnant women without stretch marks and 155 pregnant women with stretch marks. In the group without stretch marks, less than 2 out of 10 developed stretch marks compared to the normal incidence of more than 6 out of 10. And those that did develop stretch marks only developed mild to moderate stretch marks. In the group that already had stretch marks, Stratamark was shown to treat those by reducing their severity by 47%. Overall, 88% of the women reported an improvement in colour, 86% reported a reduction in visibility, and 83% reported a reduction in itching. In a second study in Australia of 272 pregnant women, Stratamark was shown to reduce the number of women developing stretch marks by 30%. And again, those that did develop stretch marks only developed mild to moderate stretch marks. Dr. Chris Hughes in Adelaide, who conducted this study, stated that Stratamark currently sits as a standalone topical treatment that is efficacious and safe. And 90% of the doctors who participated in this study rated Stratamark as excellent or very good, while 73% of the women reported an improvement in the colour of their stretch marks. Stratamark is very easy to apply. Once a day after showering, ensure the skin is clean and dry and apply a very thin layer of Stratamark to the area. Stratamark will dry in 5 to 6 minutes, but if it is not dry in this time, too much has been applied. Tissue off the excess and allow the remainder to dry. Apply Stratamark once daily or after each wash. Don't massage it in as it's not absorbed. There is no need to apply other moisturizers when you are using Stratamark. Continue to use Stratamark for the full pregnancy and for 60 to 90 days after the baby is born. There are 2 sizes available. The 20-gram tube is enough for approximately 1 month during the late stages of pregnancy when the tummy is larger, and the 50-gram tube is enough for more than 2 months in the late stages of pregnancy. So unlike cosmetic products that claim to prevent and treat stretch marks, Stratamark has actual clinical studies on more than 700 pregnant women. If you're going to recommend a stretch mark treatment for your customers, choose the one that works, the one that you can have confidence in the results. Choose Stratamark from Stratpharma.